Hello, my name is Jacqueline Pauley, and I will be going over the role of sterile processing in ancillary department support. The big ideas we will be covering are the support roles of the sterile processing department in respect to ancillary departments, managing patient care equipment strategies, as well as ancillary support communication and coordination. Depending on the healthcare facility, the sterile processing department may provide services only for the operating room. However, in other facilities, the sterile processing department may be responsible for providing sterile instruments to multiple departments, such as the intensive care unit, the emergency department, the pediatric intensive care unit, and labor and delivery. Patient care equipment is any portable equipment used to assist in the care and treatment of patients. Every healthcare facility should have specific policies and procedures developed for cleaning, preparing, and tracking. Equipment that is not properly cleaned, inspected, and prepared and stored possess an infection risk to both patients and healthcare workers. Improper storage of equipment may lead to disruptions in the dispensing of the equipment. Equipment that is not properly tracked may become lost within the system, causing delays in treatment or unnecessary purchasing. The responsibilities of the sterile processing department include preventative maintenance, which is a service performed on equipment to ensure it's in proper operating condition. Preventative maintenance includes planned inspections, detecting and correcting failures before they occur. Preventative maintenance is required by the Joint Commission to have established standards that is recorded and maintained for each piece of equipment. Preventative maintenance is a joint effort between the sterile processing department and the biomed department. When equipment is brought back to sterile processing for cleaning, its preventative maintenance sticker is checked. If it is due for inspection, the item will be routed to the biomed department after cleaning. After the biomed department inspects or repairs equipment, it will be cleaned again by the sterile processing department prior to returning to service or storage. Handling used patient care equipment. All patient care equipment that has been used is considered contaminated and will be handled as such regardless of its appearance. This is important to remember, as even though an item may look clean, it could harbor microorganisms that could pose a threat to patients and staff. While equipment is being transported to the sterile processing department, a closed cart should be used to minimize cross-contamination. A route should be chosen that minimizes contact with patients by using staff hallways and elevators. PPE will be worn, followed by hand hygiene procedures after removing gloves. Any single-use item will be discarded at point of use, including components such as tubing and suction canisters. Only items that will be cleaned and reused will be transported to the decon area. Sterile processing technicians should follow their healthcare facilities' cleaning protocols as well as the equipment manufacturer's instructions. These instructions can be found in the operator's manual. When new equipment is brought in, a review of cleaning procedures should be performed to ensure the facility has the proper chemicals and accessories to process the item. All surfaces of the equipment, including crevices, cords, and switches, must be thoroughly cleaned. Managing inoperative equipment. Inoperative equipment should be identified and tagged to ensure it is routed to the biomed department for repair after cleaning. If the equipment malfunction causes harm to a patient, it should be removed from service immediately and sent to the biomed department for inspection and follow-up. The equipment should not be disassembled or have its settings adjusted. Communication and coordination. Sterile processing department technicians must be able to communicate and coordinate with multiple departments. To ensure smooth running, all departments must follow the appropriate processes. Storage of patient care equipment. Patient care equipment will be stored after it has been cleaned, inspected, and assembled. Storage can be located either in the sterile processing department in a secure location nearby or in user units. Having equipment in the user unit may make it more accessible for patient care staff, which reduces wait times on equipment that is needed immediately. The storage area should be kept clean, secure, and away from high traffic areas, such as hallways and visitor areas. Tracking can be difficult as equipment is small, mobile, and can easily be misplaced or stored in the wrong location. In order to minimize these errors, patient care equipment can be tracked manually via computerized programs or via RFID radio frequency identification chips. Tracking should include the current location of the equipment, patient information for billing purposes, as well as usage and trends. Tracking allows equipment to be available when needed and justify purchasing or acquiring more equipment. As medicine advances and new technologies are introduced, healthcare facilities must produce new patient care equipment. When a facility decides to purchase equipment, they will first identify the specific need for the equipment, then determine the type. Then they will budget the purchase and incorporate it into the system. This equipment is now owned by the facility. With equipment leasing, as with equipment purchasing, a need for the item is first identified. Then a contract is made with either a manufacturer or a leasing company, with a specific time period established. Equipment can either be returned in order to acquire new technology or purchased at the end of the contract. Equipment rental is for a shorter term in comparison to leasing. Rental can be as short as a single day, while leasing can be for years. A healthcare facility will rent equipment when it is needed for immediate use, such as with equipment shortages or for special cases. The equipment will be contracted with rental company and returned immediately after use as to not incur excessive charges. A manufacturer's loan provides equipment to a facility as part of an agreement established by facility administrators. These typically involve disposable products such as pads, tubing, and sleeves. Procedures performed outside of the OR can either be performed bedside or in designated procedure areas. The provider may use trays and kits for either invasive or minimally invasive procedures. The sterile processing department provides the sterile instrumentation as well as the tray and kits. Different procedure areas require different types of trays, instruments, and supplies. Facility departments must determine whether items used are either disposable or reusable. Reusable trays and kits must be returned to the sterile processing department for reprocessing. Disposable instruments must be identified and removed prior to reprocessing. The sterile processing department reprocesses instruments for both ancillary departments and off-site entities. Transporting soiled items must meet biohazard transport and infection prevention guidelines, and the return of clean instruments must follow the sterile transport protocols. For all items bought, the sterile processing department must be provided the manufacturer's written instructions for use and ensure the items can be processed in the department. All items processed in the sterile processing department should have written protocols for reprocessing and develop tray lists. Through communication and coordination, the sterile processing department provides critical support to many ancillary departments to ensure quality patient care. Thank you.